This is Radio Health Journal. I'm Reed Pence. This week, the nonverbal communication we suddenly can't rely on when our smiles are hidden by face masks.
It's a huge list of information that we lose when we can't see the entire face.
Is that a smile or a frown? When Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Too many people are going to Europe with a selfie stick and an Instagram agenda, and they're not even connecting with the culture and the people, and they're not even changing. Travel should change you. That's a beautiful thing.
Making the most of your getaway once it's safe to travel again. Then,
nobody has definitively answered whodunit.
The 1896 murder that echoes through modern law. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Requirements to wear face masks provoke arguments in some places. Even so, most Americans are wearing masks when they go out in public. Surveys show that, depending on the part of the country, an average of 70 to 90% of people in public are masked. Masks are one of the best defenses we have against the coronavirus, and it looks like they'll be around for months to come. But when we wear masks, we lose something most of us usually take for granted: the ability to communicate with each other without impediment. Experts say seeing all the face is essential to the way we've learned to communicate over thousands of years.
Our faces do so many things in those interactions, and even when we're not interacting with each other, when we are observing people at a distance and we can still see their faces, we can get a lot of important information that is related to social coordination, relationship issues, understanding each other's intent, and a whole variety of things that are required and necessary for keeping people and societies together.
That's Dr. David Matsumoto, professor of psychology at San Francisco State University and director of HumanTel, a research and training firm focusing on body language and nonverbal behavior. He says you'd be surprised how much we lose when expressions are hidden behind a face mask.
One thing, for example, is our intent, right? Without seeing a face fully, it's difficult for people, for example, in the security world, to know whether you have harmful intent or malicious intent or good intent or what. And so there's that one very real aspect of what we lose. But even beyond that, in normal everyday discourse, sometimes we lose facial identification. Who is that person?
One of the most important things that we get from somebody's face is information about who that person is, so facial identity recognition. We know that for this, we tend to use the whole face.
Dr. Rebecca Brewer is a senior lecturer in psychology at Royal Holloway University of London.
Humans don't tend to focus on individual features of the face. We don't tend to think that looks like so-and-so's eyes or that looks like so-and-so's mouth, for example. We tend to fuse all of the features in the face into one single object. And so we call that holistic processing. And if you can't see the whole face, then you can't do this holistic processing.
When you just think about it, I mean, for the very same reason, it was unlawful to enter a bank with a mask on, right, until recently. And that's why many criminals or people who do malicious behavior wear masks of all kinds of sorts, even before all of this COVID mask wearing. So, yes, I think it hides identity and it hides intent. And, yes, I would believe that those in the security professionals are having much more difficulty understanding the intent of individuals.
Losing the ability to predict people's intent is a major consequence of wearing face masks. Without seeing the whole face, we can't anticipate as well how an interaction might go.
We lose information about people, whether they're approachable or whether they're polite or engaging in etiquette and things like that. And of course, we lose a lot of information about people's emotional reactions and how they are reacting to us and the things that are around them. So it's a huge list of information that we lose when we can't see the entire face.
Whilst we're talking to somebody, we're usually picking up on their emotional state, and this tells us a bit about what they think of the interaction, if they're having fun, if they're bored of what we're saying and we need to change topic. Usually we can get a lot of that information from somebody's face and from the emotional states that they're communicating with their expressions. So if we're talking about emotion recognition, for example, then some emotions are really communicated by the mouth. So smiling is an obvious example. Usually we expect to see somebody's mouth shape to tell whether they're happy or not. As well as other emotions like surprise, you often see an open mouth. Disgust, you often see wrinkled nose and wrinkled mouth. So all of that information is lost if that portion of the face is covered.
Some cultures take that harder than others. In Middle Eastern cultures, where veils are common, people may look to the eyes more routinely. Western cultures, such as the United States and Europe, rely on seeing the whole package, and Brewer says a few rely on the lower part of the face even more than we do.
Particularly in East Asian cultures, the focus tends to be away from the eyes rather than towards the eyes. So it may be that this is particularly hard to not have information from the lower half of the face in cultures where you're used to paying more attention to that part of the face.
Whenever people don't have information they've grown used to having, it can produce dissonance. Without seeing the mouth, we often struggle with decoding other people.
We are just so used to engaging with others with what I call entire or whole communication packages. And our entire communication packages include not only our facial expressions and our face, and not only the lower part of our face, but also our words, our tone of voice, and then, of course, the content of our words and everything else that our bodies and our words communicate. And so when we cut off one major of cues, we're losing data essentially from that entire communication package. First of all, that puts receivers into a state of ambiguity. And people don't like ambiguity, when there's uncertainty and unknowns about things, we just generally don't respond very well. And so we look someplace.
Usually, if we're close enough, we start with the eyes.
This is often more useful for some emotions than for others. So, for example, eyes can be useful to distinguish genuine smiles from more posed or fake smiles. If a smile is genuine, you usually get creases around the eyes. So you should still be able to tell if somebody is smiling at you, but maybe only if it's a very genuine or perhaps exaggerated smile. Same with things like surprise, then you should be able to see wider eyes. So you should still be able to interpret what somebody is feeling or thinking if they're surprised. But this might be harder for some emotions like disgust. There aren't huge eye changes when somebody is feeling disgust. So I think the extent to which our communication of emotions is going to be impaired really depends on what is being communicated at that time.
Some smiles are readily apparent, even if you're wearing a mask. The eyes give it away. In fact, there are a whole variety of different types of smiles that Matsumoto says are generally put in two categories.
One is a smile of true enjoyment when we're actually enjoying ourselves, and the other is all the other kinds of smiles. Now, the smile of true enjoyment includes not only the smiling muscle that brings the lip corners up, but it also includes the activation of the muscle that surrounds the eye, and that muscle is known as orbicularis oculi. And what that muscle does is that it raises the cheeks a little bit, gives the cheeks a little shine for many people, puts a little wrinkle on the corners of the eyes for many people. It thins out the eye cover fold right above the eyes and whatnot, and it gives an overall different appearance of the smile. All other smiles, when people are not feeling happiness or true enjoyment, those smiles generally do not include the muscle around the eye.
Almost all of us use those kinds of smiles all the time as a social lubricant, an indication of friendly intent.
Let's call that a social smile. What we lose with the masks, for example, is the social smile. We aren't able to see when people are just being polite, just being friendly, showing that they're sociable or agreeable or approachable. And that is a big part of the social glue that we have that keeps us together and keeps societies functioning.
Those kinds of smiles include greetings. For example, when you run into a friend on the street and smile with an eyebrow flash.
And the eyebrow flash is often known in this culture and many other cultures as a sign of greeting. I may also supplement that meaning with a smile. Now, that's not a smile, well, maybe a smile of true enjoyment, or maybe a social smile, but what I'm saying is that the smile then is used to supplement another expression. There are many of those kinds of smiles with the eyebrow flash. Sometimes we're sad, but we smile to show that although we're sad, things are okay. Sometimes when we're angry or frustrated with a child's behavior, we may express our anger, but also smile at the same time to soften a little bit of the impact of the frustration or irritation. So smiles, on a most basic level now, there's a true enjoyment and then the social smile, which is just the smiling muscles going up on the lip corners. But then the smiling muscle can be combined with almost every other kind of expression that we make to qualify the meaning or to supplement the meaning.
Many of those smiles are lost behind a face mask, so both Matsumoto and Brewer say it may not be a bad idea to be a little more expressive than usual now in other ways to make up for it and be understood.
Yeah, I think that's really a good idea. And it's difficult, right? But it's a good idea to be a little bit more conscious, especially when we're in public. And especially when you see somebody that you don't know and you're looking at each other. Nowadays, I notice there is a little more awkward 1-2 second kind of time period where people are looking at each other and kind of figuring things out until somebody says a kind word, has a nice tone of voice, maybe does a wave of the hand or something. And I think those kinds of gestures and words go a long way to make up for what we're losing in those facial expressions. So, for example, now, even though we might see a stranger on the street and even though we can't see each other smile at each other, maybe there's a little wave of the hand just to say, hello, how you doing? And we look for other cues within that entire communication package, including the words, right? Including things we might now say where we didn't say before, like, hey, good morning, how are you? Instead of just a nod and a smile.
I feel like people probably will realize if they're not being expressive or if they're not being recognized in the way that they normally would, people might start to exaggerate other cues. So people might use more gesticulation, or they might change their voice more, or they might make bigger movements with their eyebrows, for example. So it's hard to know, I suppose, whether we're going to exaggerate those things as people wearing masks, or whether observers are just going to have to get used to using other cues, even if they're not exaggerated. And it's probably going to be a combination of both.
Occasionally, medical conditions mean that people are unable to either read the faces of others or let on through their expressions what their emotions are. Mobius syndrome causes a paralysis of facial muscles and therefore no expressions at all. People with what's called face blindness can't put together facial recognition cues and can't identify by sight even their closest friends and family. Still others are simply poor at reading emotions on faces. They simply don't click. All of those conditions result in awkward interactions and a difficulty navigating social situations. Lately, face masks with clear plastic windows over the mouth have become increasingly available. Those will help hearing-impaired people who need to lip read and may make it easier once again to read each other's faces while still staying safe. I'm Reed Pence.
Detecting the brain changes of Alzheimer's disease before symptoms appear can be done today only through expensive PET scans or spinal fluid tests. But researchers are homing in on a simple, inexpensive blood test that might spot changes up to 20 years before symptoms appear. Multiple studies presented at the Alzheimer's Association International Conference 2020 show that specific proteins are detectable in the blood as early as age 25 that correspond to the buildup of toxic tangles in the brain. Dr. Maria Carrillo is Chief Science Officer of the Alzheimer's Association.
These are early results, but they are encouraging. There is an urgent need for simple, inexpensive, and non-invasive diagnostic tools for Alzheimer's. An early blood test would allow people with Alzheimer's and those at risk to plan for the future, and it could speed drug development by identifying the right people for clinical trials.
Dr. Carrillo says the tests require further large-scale studies before they can be made widely available. Find out more at alz.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
We can be better and better prepared. So are we going to have every threat have a drug and a vaccine and a diagnostic for every threat? That'd be a tall order, but boy, we should have a lot more of them.
Preparing for the next pandemic.
Then, what medical care really means in the poorest of countries.
Patients that would easily be diagnosed and treated die what we call stupid deaths, deaths that would never have happened if the patient had just been born someplace else.
All that and more on Radio Health Journal.